I'd like to welcome everybody tonight. We're going to start this call to order, our regular meeting, October 17th, 2022. I'd like to ask everybody to mute your cell phones, please. I don't see anybody with no ball caps, so we're doing pretty good. All right, commissioners. Can answer the roll call now. Three, 22. Got 22 present, 2 absent. I declare we have a quorum. Thank you, commissioners. Before we start, I'm going to ask Commissioner Hogan to do our invocation, and our pledge to the flag will follow.
Let's pray, y'all. Father God, we just love you and thank you for the day of opportunity to serve you here in this county. We thank you for the county that you've given us to operate in. And we pray now, Father, that you'll give us the knowledge that we need this night to honor this county for you. We also ask that you give us the understanding that we need, that we can handle the knowledge that you give us. And Father, even much more than that, we ask for your wisdom so that everything we do and say this night will bring honor to you, Lord. We thank you for those that are here. We thank you for those that have protected us in this freedom that we have so vastly here in this state and this county and the United States. We ask that you continue to protect them. Father, we've lost a few people this past month. We pray for those families as well. And Father, as we go on this business time, we pray now that you'll give us what we need to do and when we need to say it and honor you with it. Lord, we love you. Thank you for loving us back. And we ask these things through your precious name.
Amen.
Allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all.
Thank you, Commissioner Hogan. Okay, commissioners, your minutes of the previous meeting is in the package. I'll entertain a motion to approve. Got a motion by Roberts. Second by Commissioner Hubert. Hebert. I'll get that right. Hebert. You need to keep making seconds so I can get that right.
Actually, it is head Heber.
Okay, head Hebert.
But he can't, the computer does not like the hyphen.
Okay, thank you. Any questions? Before the minutes been filed, vote aye. Aye. Against it, vote no. I declare these minutes are passed. Thank you. Communications from the mayor. First, I'd like to say this package is going to be very different tonight. We've been working on it to exactly probably 10 minutes ago. So it's going to be different. We had our mayor's conference last week, and I was walking through the conference room where all the vendors was, and somebody hollered out, "Hey, Mayor Vogel," and I didn't know who it was, but they was playing our meetings in front of the whole conference group. The vendor that has this program we're using, Cat knows who they are, but our programs are being watched all across the United States, he said. They're using us as an example how to conduct meetings. Yes, they are. Yes, they are. Because the reason I'm telling you this, we won an award for that. But tonight's agenda is going to be a lot different with some a lot of discussion and changes. I want you to remember that people are watching us in Los Angeles, California, all the way to Tampa, Florida. So let's remember that. All right. First, I want to welcome our EMS director, Brent Dyer. Would you stand up, Brent? Appreciate you having you aboard. Anything you'd like to say, I'll make you a member of the court. Okay, thank you. And also, I want to welcome a new highway superintendent, Dudley Atkins, but I know him better as Troy. Thank y'all. Thank you for serving. I got faith in all of y'all. Okay, November 3rd, we plan to have a meeting with the zoning board, which is on their meeting night here in this room. I want the county commissioners to be welcome to attend. We're going to go over our growth study plan that we just did. Ladies is going to have a presentation to make it to everybody, and there will be a meal served. Is that right, Margot? Yeah. We're talking about meeting what, at 6:30? What time zoning board meeting? 7? Okay, we're meeting at 6 then. Y'all think about our head. Yeah. So we're gonna be eating and everything. Y'all need to attend that because there's a lot of work went into that. We met at several cities. People came, gave their opinions, and yes.
6 or 6:30.
6.
Okay.
Since we're gonna eat and give them time to explain. I think that'd be best with Margo. Yeah. Give them the time to present their presentation. We got a $50,000 grant from the 3-Star program to put this on. And I think it's gonna be interesting. A lot of people think it's gonna be a lot of changes. We haven't done one since, when was it, 2013? Yeah. So it's gonna be something different. November 3rd, gang. Okay, I'm gonna say that I signed the papers off on our 911 radio system and their towers. That's behind us. Look forward to getting started on that. Okay, 2 weeks ago, we got with Chance and Amanda, met the department heads. We're gonna start a new disaster planning program. Jesse Wallace was mayor of Waverly. And after the flood deal, they was completely wasn't prepared for what hit them. And if 2 tornadoes came through here and took the courthouse down or took the office building down, maybe took down at one side of the county, we want to know where everybody's at, where the boots is on the ground, who's in charge, where, and the steps that we got to take with firefighters, our people that supply water, and even the people here in this office building. It's got to be where we can come up with paperwork. Everything has to be documented. That mayor told me 6 months after the flood, he still had a stack of FEMA papers that deep that FEMA will not pay off on till every T is crossed and every I is dotted. We want to be prepared for that. I'd rather us go to a lot of pain than the next day somebody say, what are you going to do now? Sheriff's involved, all the cities are going to be involved, and even the employees of Robinson County, regardless of your job, you'll be involved, helping us get everything straight in case, heaven forbid, we should be in disaster. So y'all get ready for that, because you commissioners are going to be pretty involved too. All right, I think I'm down to Ridgetop. Let's see, October 28th, 29th, and 30th at Ridgetop Park, we're having a reenactment. Does anybody remember Morgan's Raiders during the Civil War? There was a bunch of renegades, I think. They didn't really have a side, but they're going to have a reenactment. That's going to be at 1:30 on Saturday. Sunday and Friday, it's going to be the 28th, will be a day for the children. And kids will be free. That's going to be something new they're trying. They're real excited about it. So I told them I would announce that tonight. And last but not least, I'd like to introduce our HR lady, Marissa Combs. She'd like to come up and make a presentation. If I can get a vote to make her a member of the court. Got a move Roberts, second by Woodard. All in favor say aye.
Aye.
Okay, thank you.
Thank you. Appreciate the introduction. My name is Marissa Combs-Smith. I work with 5 Points, which has been your broker for a while on a lot of your products. We're not the broker on the medical, but I work with Gallagher now. We've actually all become one company. And we manage your medical clinic. So I wanted to give you an update on that. I know many of you are new commissioners. So we wanted to provide you with an opportunity to understand what the clinic is and what it isn't, kind of just a quick what's going on with that, because it opened about a month before the official transition of commissioners. So with that, it's been open since August of 2022. We would expect to see lower usage in the earliest months and then kind of ramping up. With winter time coming and flu and illness season, that type of thing, we would expect some higher utilization. This is the most utilized location of clinics that our provider has, and they have several public entity clinics. It has surprised us. I think it's a good surprise in the sense that it is partly due to access to care limitations in your county. I'm from Robertson County, had 2 babies at Northcrest. So I know what a vital role that some of that plays in our community. And in this particular instance, we've had a couple of clinics close. And so there is no real PCP, primary care option. So the employees of this county, of the city of Springfield, and the school system are all sharing in this clinic. The usage rates, we're allowing, you all had decided as a body to allow part-time employees and their eligible in-home dependents and spouses, full-time employees and their eligible in-home dependents and spouses, and commissioners and their eligibles as well. And I will tell you, 100% of you as commissioners have signed up properly. We have you on our roster. So if you sent me an email, we gathered all of that. We made some phone calls, you're in. We had 62 new patient visits in the first quarter, which was Q3. Kind of closing out some of those numbers, obviously, but 62 new patient visits, 25 established patient visits, which as a new clinic, that means 25 people returned for an additional service or a follow-up to the initial visit. That's a strong indication that they like the facility and trust it. We like that number, and that's just for county employees. There have been other users of the city side and the school system side. Total in the county, combined with the city and the school system, there are 496 new patient visits and 152 established patient returns. So again, good feedback. The county is not using so far really a lot of workers' comp visits. In the county as a whole, including the other employers, we've had 4 primary work comp visits with 1 return checkup. So that's a good number as well. We want to see that trend continue because that means they're managing those issues and getting folks back to work. As far as estimated costs of operations, you have a monthly fixed fee that you pay for that clinic. Your portion is pro rata based on your eligible folks. It's $4,395 a month. That's part of Ms. Stewart's report to you in the fiscal report. It's in that as an itemized line item. It's a fixed cost, stays the same every month. And the clinic provider saw that there were a little bit longer wait times than what we really wanted to see this soon. Especially, without it being flu season, so to speak. So they've added another medical assistant at no additional cost. So they're eating that cost, but they've put another staff member in the clinic. So I thought that was a good sign of good faith to really try to keep those wait times down. Let's see, what else? The estimated savings offset. I think this is important to note. Productivity savings estimate. We're using roughly 3 hours for every visit to calculate that number because by the time somebody leaves this community to go to an appointment and then return, pretty much looking at 3 hours minimum. So roughly 3,300 is the estimated savings of that based on a blended rate that we've used. And then roughly 17,600 in a comparison to what we would consider local cost of care. Access to care can make it cost more than that. When we have trouble accessing it, providers can charge more, but we're using a baseline of around $200 per visit. We would expect that savings over time to start to influence the plan so that you're actually spending less on your medical plan. As I mentioned, I'm not the broker on that, so I don't have total visibility into your data, but we would expect to see that trend. So that's good. I'm estimating in just the first this past month's reporting roughly 16 or so thousand in net savings. It's an estimate at this point. We've got to see some raw data as it kind of continues to come in, but we'll give you updates. I also wanted to give you an enrollment report, which is we made a concerted effort to go into the county employer locations all over the county and meet with teams and teach them about their benefits this year at enrollment and really do a good job educating them about the medical plan, dental vision, all the voluntary products. And I'm really pleased to tell you that we have 237 of your employees enrolled in benefits, which for new lines of coverage, it almost tripled. That's a good sign. That means people responded to that education. They understood what they were hearing and wanted to protect their paycheck, for instance, with disability insurance. 17% increase in your participation is what happened as a result of that effort. We're really pleased with that. I think that's also a sign of coming out of the pandemic and seeing folks understand that some of these benefits could really be of value if they're missing work, that type of thing. 37% of your workforce is enrolled in short-term disability. Now, why am I telling you this granular detail? It's because that's how they protect for things like loss of a paycheck in the event they're out of work for more than 14 days. It covers things like accidents, pregnancy. That's a big one because disability insurance, even though you're not disabled when you're pregnant, for a short term, you're unable to work. So it covers for those. And then also sickness with a 6-month maximum. And you have 28% of your workforce on long-term disability. So we're pleased with that number. Finally, wanted to share with you your HR update. Gallagher serves as your HR representative, kind of outsourced HR. And our most recent efforts would be Charlotte is my teammate, Charlotte Jensen. She and I work together on this, but she's primarily your HR consultant. She handles calls from department heads. I think fairly quick with her responses. We've gotten some great feedback. We're doing 8 positions, a comp study for 8 positions right now, which is a lot, but just trying to get, some additional services that we're not charging extra for at this point. We're just trying to manage it out of that existing budget. So wanted to give you that update. And I'm happy to take any questions.
I have one quick question.
Yes.
If a patient showed up and they either had spousal or other commercial care coverage, I'm assuming you would bill the right CT code to their coverage and keep the money.
We do not. That's one of the differences in our model.
Okay.
So we've put in a clinic here in the county that does not ever hit the insurance of any
Okay.
insurance plan. It's a capitated model, which means you pay a specific fee every month for the operation of the clinic and no insurance is involved whatsoever. So it's not increasing your plan costs. In fact, it should trend it down.
Anyone else?
Is there a possibility we could get an MD eventually?
The clinic is your clinic. So if you really wanted an MD, certainly that is something that could be factored in, but the cost would be significant. I think at the moment, the current staffing model is medical director managing a nurse practitioner and then MAs.
I was just looking at something on down the road.
Yeah, certainly if the budget were there and you all wanted to spend the budget in that way, we are happy to do that. It's not a limitation we would have.
Have others done that?
I'd have to talk to the clinic provider about
Okay.
that, but I have not seen that model in public sector in Tennessee. No.
Okay.
So have you found another NP?
There is a nurse practitioner that works 4 days a week. Yes, Amanda. And then there is a nurse practitioner that fills the 5th day. She comes in 1 day a week to fill in that day because the model that Amanda was used to working under was a 4-day, 12-hour shift. So we filled it with the 5th day being somewhat different. She was really loving that 1 day off, and we want those to be happy. So,
Steve, if you're questioning the NP, I'd rather see the NP that's there because she's amazing
yeah.
than an MD.
The feedback we've gotten in terms of the quality of care has been excellent. Wait times are fairly low, even though it is a very saturated clinic at the moment. I think that's also why they put that extra MA in to try to facilitate some of that. We should see it level off, but the newness of it and what we've not seen before is an access to care change in the middle of opening a clinic, which is really what happened here. Not only do we have the plan that you will have not remain in network for your local hospital, which was crisis number 1, but we also had the closure of a couple of primary care, locations. So you've got kind of a double thing happening that's making it a little bit more stressful in the
That's why I
clinic.
asked that.
Yeah. And maybe in your market that becomes something you want to look at, but the clinic sees patients 2 to 100. It's a very broad clinic, but not pediatric under 2.
Do we know how many other counties in the state offer this kind of service or is it comparable?
I would have to do some research. It's a lot. What's unique about yours that's a first time thing, as far as I'm aware, is the combination of a county government, a school system, and a city government coming together to share that resource. And I think that's one of the things we're most proud of because it's a creative solution that A, shows how well y'all work together because you're here in a community together, but then B, I think, Robertson County government would not have spent the money to do this on its own. You're paying a pro rata portion. So you're adding an employee benefit that really, when you look at the total spend, is so much less than you would have spent to add, a richer medical plan expense, for example. When we increase the richness of the coverage of the plan, it really goes up, but this is a way to increase the benefit level without really changing the cost of the plan. It actually takes it down.
I was just wondering, I know when we set this up that this was gonna be like a walk-in clinic, but you could make appointments. Has it gone to more just straight appointments, or are people still just walking in?
You can walk in. We encourage appointments. They will do their best to see anybody within the same day that they can who's sick. But when you're talking about like making a well visit, for example, about half of your population is on an HSA plan and is only eligible to use the clinic for well visits right now. That could be tweaked with a plan design change. I mean, if I manage your plan, I'd probably think about that. But in terms of the rest of the population, they can use it for illness, for well visits, for medication management visits, things that you would use a PCP for. Yeah. So I do think the access to care is creating more of an appointment structure than
What I was wondering.
yes. I think I haven't looked at the numbers in the last week, but I think for sure, that's another reason they're trying to really work on that with the staffing of an additional MA at no cost.
I'm impressed with the fact that we're offering some part-time folks that benefit of the clinic, like bus drivers.
Yeah.
And things like that. It's something they didn't have, and that will keep our employees here and not going somewhere. I think it's.
Yes, sir. To your point, you have 1,846 eligibles on the school side, and 290 of them use the clinic in the first quarter it was open. And of those, that's about a 10% utilization rate, which is a lot. Their utilization was around, I think it was like 13%. But the highest percentage of users in the school system as a percentage, it was more weighted towards some children and spouses, which I think kind of indicates it's a valued benefit. You don't have to have paid insurance premiums to use this. You could decline the medical coverage and use it. That's a really rich benefit.
Plus, somebody will take better care of themselves, and it's less downtime, it's less missed time,
Yes, sir. There's actually a story from one of the clinics that we manage that an employee had kind of a problem in his throat and was kind of noticing it nagging, but went for a well visit, and they did the labs, and I think that's an issue. That doesn't bother me. The nurse practitioner was bothered by it. Sent him out for some additional testing, and he actually wasn't an insured, and he had early stage throat cancer. So early prevention, yes. Early detection.
Can people that are covered under the county health coverage, can they use this service?
About half of them currently, and the reason for that is a federal IRS rule. It's not a rule that your commission passed or something. It's nothing that the finance office did or the mayor. It is, if you have a health savings account with a high deductible plan, which about half of your members are on, then you can't also use first dollar coverage, we call it, at a clinic, because it's double tax benefit. So you would have to exhaust your medical coverage out of pocket, come in and prove that to the clinic to be able to use the clinic if you're an HSA provider or HSA participant, but all of the others can use it. That was one of the reasons we did an extensive education process before enrollment, because we wanted to afford every employee an opportunity to change their plan choice to move to the one that wasn't an HSA so that they could use the clinic. Of course, they didn't know there would be a network change with the hospital at that point. It wasn't totally solidified. Kind of thought it, but we didn't know. And we also were not obviously aware of the closure of some primary care. So maybe more people would have chosen that if they had known that. I don't know. But the next open enrollment, they can make that decision potentially. Or if I were your broker, I would want to look at an HRA option, which does not carry that same tax limitation.
Is there a waiting period for new hires?
For using the clinic? No, sir, we're taking a month by month approach to adding to the list of eligibles to attend the clinic. So if you're hired today, by November 1st, I would expect we would see that list go across to the or a few days after the first, to go over to the clinic as a new hire that could use the clinic at no additional charge. No charge, I should say. But if you're not a new hire, it's every year at open enrollment, we set the census. It's just too much back and forth to set the census throughout the year for people to add their name that they didn't do it before, but now they're sick, they want to add their name. That's a lot. So we're kind of once a year, you got to get in and put your stuff in, you know, to enroll in the benefit. That was a great question. It's a great benefit. Yeah.
Other than staffing, is there any other stress points you're seeing this early that might need to be addressed coming up?
No, everything else is running great. I would say if anything, you know, just as the word spreads of how good it is to use it, there's plenty of space to expand the clinic. Obviously budget matters, and we would never do that without this governing body and the others participating in that decision. But there is plenty of space to do that if necessary. But for now, that's really the primary thing, is just looking at utilization.
No downsides, Mayor.
Yep, that's a good question. Trust me, if there was any problems, my phone would be ringing. And I haven't got a call, so everything must be going great.
You just called it down.
Yeah. Anybody else got a question?
I have one. The percentage you named the county employees that had insurance that are not covered, are they aware that they're able to, at a certain point, to get into the clinic, and how they can go back to that option?
Yes, sir. That was extremely important to both me and also the mayor and the finance office, that we do a good job making sure those employees knew at open enrollment they had an opportunity to change. So we literally went, I mean, I was at one morning at maybe, I don't know, 5 o'clock, I think it was, at one facility to teach those employees about this clinic coming. At the time, you know, I think because it's new and they don't really know what to expect, there are questions like, well, will the county have access to my medical records? No, it's a totally separate totally separate clinic. You know, we had some hurdles to overcome, and I think people are just, anytime you try something new, a little bit skeptical, but the word, I think, is spreading. I think you'll see continued increase use of the clinic.
Thank you.
Yes, sir.
Anyone else?
Thank you for having me.
Thank you. Thank you. Okay, I've got one last pleasure to do. Earlier this month, I had to do a proclamation for the 4-H group. Would y'all like to come up?
Yeah, that's great.
We're gonna take pictures.
All right.
Okay, I think it was October, about 3rd, 4th, 4-H week?
Yes, sir.
Yeah, and they came to my office and I told them they'd come back tonight. We do this again, 'cause I think it's worth mentioning. Our West 4-H is America's largest youth development organization, having supported almost 6 million youth across the country thus far. And whereas 4-H is Tennessee's largest youth development organization, having supported approximately 136,000 youth across the state. Whereas 4-H has helped hundreds of youth in Ross County become confident, independent, resilient, and compassionate leaders. Whereas 4-H is delivered jointly by the University of Tennessee Extension System and the Tennessee State University Extension, both members of Cooperative, a community of more than 100 public universities across the nation that provides experiences where young people learn by doing hands-on projects in areas including health, science, agriculture, and citizenship. Whereas National 4-H Week showcased the incredible experiences that 4-H offers young people and highlights the remarkable 4-H youth in Tennessee who work each day to make a positive impact on those around them. Whereas 4-H network of 600,000 volunteers and 3,500 professionals provide caring and supportive mentoring to all 4-H people, helping them to grow into true leaders and visionaries and interpreters. Now, therefore, I, William A. Vogel, Ross County Mayor, do hereby proclaim October 2nd and 8th and tonight is 4-H week in Ross County. Encourage all citizens to join me in this worthy observance. Introduce yourself.
My name is Alan Jones. I'm serving on the Honor Club as the president, and I'm serving on the state 4-H council as the senior representative for Central Region.
Okay.
I'm Preston O'Neill, and I'm just an active member.
Tell me your school too.
Springfield High.
All right.
I'm Allie Walker, and I'm an active member, and I go to Springfield High School.
I'm Abby Newberry. I'm an active member and I go to Joe Burns High School.
My name is Ricky Cox, and I'm an active member, and I go to Joe Burns High School.
I'm Tessa Palma and I'm an active member and I'm homeschooled.
Good.
My name is Brittany Palmore. I'm an active member and I'm homeschooled.
My name is Eric Cameron. I'm an active member, and I'm also homeschooled.
Good deals. I'm gonna present this to y'all. I'm gonna give this to you, Cameron. And get pictures?
Yep.
Everybody like to get pictures?
Let me get one more with
Yeah.
on the side. Thank you.
Thank y'all for what you do. Thank you for what you do too. Thank you, John. They're all leaving. I don't guess they want to see us mess up. Okay, commissioners and end reports. We'll start with a highway report. Any questions or comments? Animal control, any questions or comments? Solid waste, any questions or comments? Trustees report, any questions or comments? EMA report, any questions or comments? Fire committee, any questions or comments? Planning, any questions or comments? Veteran service officers, any questions or comments? The EMS report, any questions or comments? Finally, finance report, any questions or comments? Hearing none, I have a motion to pass the reports.
I move to accept an order file.
Got a motion by Haley. Second by Commissioner Romo. All in favor, say aye. Aye. You're against, vote no. Okay. Reports are filed. We have no elections or appointments tonight. And we have no public hearing on planning and zoning. We had a slip of a pencil where a wrong date was put down for tonight. The county attorney advised us, I think we had two on there. Advised us just wait till next month rather than do it. And maybe the public wasn't aware that we was doing that. So we'll move to our new resolutions. Chair recognizes Chairman Bobby Couts of the Budget Committee.
Mr. Mayor, Madam Clerk, fellow commissioners, honored guests, I'd like to present to you resolution 101-722-098. If I get a second, we'll discuss.
A second, Commissioner Roberts.
This is an amendment to put a new roof and HVAC system on the dental clinic and to reseal part of the shower floors in the jail.
Any questions for Budget Chairman? Ready to vote? Question being called. If you're for this resolution, vote yes. Against it, vote no. Got 22 for and 0 against. I declare the resolution passes. Commissioner Couts.
I'd like to present resolution 101-722-099.
Hey, let's suspend the rules on that, Bobby, first.
You're right.
Yeah.
We'll go back to first. Your motion to suspend the rules.
Mr. Chairman, I move that because of the urgency of this particular motion we just passed, and only this motion, let's suspend the rules and vote again on this motion.
Motion to suspend the rules and vote again. It usually takes 2 readings, but because of the time frame with the projects being funded, ordering material, and how long the projects, the contractors make the bids good for, we need to suspend the rules and vote for this, and get this in action. I got a second by Commissioner Haley.
And it is 30 days that for the reason we're having to do this.
Right. These projects need that to be done anyway. Putting it off dead in the winter, just make it come back, cost us more money probably. Question being called. You're for suspending rules and passing this resolution on second reading. Vote aye. If you're against it, vote no.
Aye.
Wait a minute, you don't take a voice vote, about suspending the rules? Okay. We just voted to suspend the rules. Now, if you're for this resolution to spend this money, vote yes. If you're against it, vote no.
We need a motion. I so moved.
I got a motion. I thought Bobby made the motion. I got second by Hogan. We don't spin the rules very often, gang.
Question.
All right, question being called. If you're for this resolution, vote yes. If you're against it, vote no. Commissioner White, I like the shirt.
Thank you, sir.
I don't.
I got 22 for, 0 against. I declare resolution passes. Commissioner Couch.
I'd like to present resolution number 101-722-099. I'll get a second. We'll discuss.
That's second, Commissioner Hogan.
So this is a motion to fund a buyout for a Parks County employee that has resigned, and this is her payout for time off.
Okay, we're in employee leave in the finance department, and we're just doing some taking care of business. I got a second by Hogan. Any questions? Question being called. If you're for this resolution, vote yes. If you're against it, vote no. Got 22 for, 0 against. I declare it resolution passes. Commissioner Couch.
I got another one.
We're gonna let Commissioner Ayers do this. Stand aside, stand ready, Bobby. You'll be right back. Chair recognizes Commissioner Ayers from the Law Enforcement Committee.
Madam Clerk, Mayor, Commissioners, yes. I bring to you tonight resolution 101-722-100. Get a second, we'll discuss.
I got a second by Commissioner Heber.
This is to declare a 2015 Ford Explorer surplus property from the Sheriff's Department. It's my understanding that it's going to be a department transfer to the EMA. Is that correct? He's nodding his head. Right?
He's nodding his head up and down. Okay, you're right, Commissioner Ayers. Way to go. Yeah. Any questions? Question being called. If you're for this resolution, vote yes. If you're against it, vote no. At 22 for, 0 against, I declare it resolution passes. Chair now recognizes Commissioner Bobby Couch again for delegation of ARP funds.
Present resolution number 101-722-101. About the American Rescue Plan.
I got a second, Commissioner Roberts. This is gonna take some discussion. Bobby, you ready for this?
Oh, if I'm not, I'll get help.
Okay.
So this packet, everyone should have seen this in their packet. What we're doing is distributing funds that this federal government decided, or the state decided to let us have.
It came down from the federal government, the chair said, it came down from federal government to the state. It was about $9 million. The county mayors asked the state to take it back and divide it out among the cities and the utilities. They paid the cities their part, then they sent it back to the county for us to give to the people out in the county part. We picked cities and utilities, water district utilities were left out. So I used meter counts. We left, I'm just making a long story short, we included Coopertown, Portland, White House Water District, Orlando, Cross Plains, Adams City Hill Water District. TDEC has already come back and said Coopertown's plan will not qualify for what this money's for. Portland is in a, what's a good word, Margot? Collaborative with Sumner County. They can't use the Robson County side of the money, so they're out. Orlando and Cross Plains had something to do with their sewer DEMA system. Find out tomorrow, I hope by 3 o'clock, whether or not that can be approved. So if that's not, or if it is, we got some money that came back, or that's coming back to what we had allocated at Budget Committee. This resolution is saying that whoever qualifies among the ones that are left, money will be divided among them. It will only be used for the scoreboard red spots that they know that this will work. It's like I told GNRC today, I said, I don't want to be reaching in a bush for 2 birds when I got a bird in my hand. We don't want this to happen again because we're running short of time. This does need to pass. The money will be allocated fairly as it was before. But right now, I can't tell you what's going to be allocated because we don't know what's going to happen with them two cities.
We can tell them all of it except those 2 cities, right?
All but, yeah, all of them 2 cities. And there will be money if their projects don't work or meet qualifications, that these cities that do work will be getting a bigger portion. Margot, you got anything you want to add to that?
You might mention about the 3 cities that are getting transferred money because they have their own applications that we're going to transfer them.
We, since Greenbriar's already got a plan, Ridgetop's got a plan, and Springfield's got a plan. Millersville. They've already, their money that we sat in the Budget Committee will go to them, but they will be submitting that money on their plan. Yeah. Now, the county was going to take a certain amount to do stormwater at our parking lot. We're fixing to put in for new parking lot money. GNRC recommended for us to go ahead and donate or designate, better word, that money to Springfield because the stormwater system that runs in the sewer will become by Springfield doing the work. And that way we're not having to do paperwork that may get turned down. And this way we know it won't get turned down. It's $260,000 to do the work for our stormwater. Sounds like a lot, but the last time we did a parking lot over here, it was $150,000 for that water to run in the sewer. And it was baffled in different ways where it wouldn't all run at once. It's very expensive, very stormwater is. So that's pretty well the nut and bolts of it. Anything you like to add, Margot? Let me tell you, she's worked hard on it. I mean, we've got Friday come in that these cities have been disqualified. And today we have done everything we could do to get this in front of you tonight because this has got to be passed tonight. Any questions from the county commission?
Yes, sir.
I got one from Madam Clerk here.
Remind them this is correct. Remind them this is correct.
Okay, correct the resolution number, Bobby. The ones that they was handed out to them doesn't have the whole numbers involved.
What's the other resolution? Oh, you got a different one.
It's the same number, I just left off.
That's the same one.
Yeah, but it's not the same.
That's a different resolution. So everyone should have a copy of the new resolution.
Read the numbers for the record.
101-722-101.
This is the same resolution as in your package, except it has probably had a few words added because of the cities that didn't qualify. That's the only difference. That's the only difference. Okay.
There's more up there. Anybody didn't get one, we can hand them out. You get one?
That was right there.
I have one there.
I need to hold background. Okay. Thank you, sir. Hey, while you're reading all this, Commissioner Rummel, you like to speak?
Yes, sir. First of all, thank you for your hard work and Margot's hard work on this project. I think we've come up with a really equitable solution here for this, and I think it's really a good plan. I did have one question for clarification. These projects that were not approved, is the amount that's allocated going to remain the same, and it's just they're not approved regardless of the project? The project's going to change, or has the amount been withdrawn?
Yeah, that money will go back in the pot. I'm gonna use, for example, Coopertown needed to do some money with stormwater, but they wasn't gonna run it into their sewer system. They was just more or less gonna ditch it and reroute the water. It did not qualify.
So Coopertown's just out, they're not going to get.
They're out, but if we give Springfield a little more money, then Springfield assured me that they're gonna help finish the line. It goes into Coopertown to help their capacity. That is what the state wants. If White House Water District gets more money, they will work on the capacity going into Ridgetop and the cities they service up and down 65. And that's what it's all about. Everybody's filled out these scorecards. There was red dots that had to meet the first, really what they want to be done first. And these cities that's left have done that. So,
I'm in support of approving this, but these allocations that don't get approved, the additional funds, how will that be allocated? I presume your office will.
We'll sit down with the industrial board and we'll, I don't think we're gonna look at a whole lot of money, because the ones that didn't get approved wasn't getting a whole lot. Because all they was talking, they might not have a water system, but they might have their own sewer system. The bulk of the money went to the people that's furnishing water out in Robinson County.
Does the resolution give accommodation for you or ECD to reallocate the funds then?
Yes, it does.
That's all. Thank you, sir.
Thank you. Good question. Be transparent. Anybody else? Question being called. If you support this resolution, vote yes. If you're against it, vote no. Got 22 for and 0 against. That resolution passes. County Commissioners, I thank you tremendously. Okay, Chair recognized Commissioner Counts.
I got another one.
Chairman of the Budget Committee. You don't have that one? You got it.
Resolution 101-722. 102. Resolution to approve the economic impact plan for the tax increment financing program for the TIF for Meridian Group.
LLC.
LLC.
I got a second, but Roberts. I would love to make Margot a member of the court. She's a chairman of the industrial board, and she's the one that's helps us do these things. So I got a motion.
Second.
I got a second, Commissioner Hogan. All in favor, say aye.
Aye.
Anyone opposed? Margot Fidus, welcome.
Thank you. So we are bringing this back to the first TIF that this body approved. It was for the Town Square Commons project in Greenbrier. This happened pre-COVID. Part of the TIF economic impact area included the McDonald's project, which was delayed because of COVID, is now open and now, built and generating more property taxes. The developers were really at a disadvantage because of that delay, and also because the assessments of the property once complete were not as high as what we estimated in the beginning. So we're keeping all the dollar figures are the same. Nobody gets any more money. It's just extending it from 12 years to 20 years to allow them more time to recoup that amount of money, and also adding 2 parcels or 3 parcels to the economic impact plan that Meridian Partners have purchased in the meantime. This has been approved by the Robertson County Economic Development Board and also the Greenbrier Board of Mayor and Alderman.
Where are those 3 additional portions?
For the Greenbrier Pizza and Pub, the Meridian offices.
Okay.
There's one other parcel that makes it contiguous in between them.
Thanks.
Anyone else got any questions?
So that parcel that's beside McDonald's where Douglas had their video store, that's included?
No, it was never there.
Never in there. Okay.
Question.
Anyone else? Mr. Roman,
There's so this is extending the term from 12 to 20 years. Is 20 years the maximum
Yes.
allowed under legislation?
Yes.
good question.
Thank you.
Anyone else?
Jody Doris is here on behalf of Meridian, if anybody has any questions.
Hey, Jody.
He's hoping we don't talk.
I'm happy to answer your question.
I think all of you would agree that this has been a good project. The improvements that the TIF has paid for are very nice improvements that have created a town square feeling in Greenbrier that they didn't have before.
Yep, it's nice.
I'm doing the.
Mayor, I don't have a question. I just want to commend y'all for that work. It was, I mean,
That's great.
I think more areas should take note of that. That was a beautiful improvement to the area and well.
I really enjoy the wings at the pub.
Looks good.
Call.
Question.
All right. If you're for this resolution, vote aye. If you're against it, vote no. I heard they are good wins. I got 22 for, 0 against. I declare that resolution passes. Thank you, Commissioner House. Chair now recognizes Commissioner Wood.
Here we go.
Honorable Mayor, fellow commissioners and ladies and gentlemen of the audience, I bring you resolution number 101-722-103. That's what we heard to elaborate.
Got a second by Commissioner Stubblefield.
This resolution is a resolution to establish Juneteenth as a legal paid holiday for Robertson County government employees and first responders beginning on June the 19th, 2023. And I have talked with the chairman of the budget committee and which recommendation we talked. I think we're going to table to the next month to see if we could recommend a holiday to exchange for this Juneteenth holiday.
Mr. Roberts, you'd like to speak?
I'd like to make a motion to table it to next month.
Okay, I got a motion to table.
I'll second that.
Got a second by Hogan. Everyone understand why we're tabling it? Probably need to go through the personnel committee, maybe the budget committee to go budget the overtime. And probably we're looking at maybe another holiday to swap it with because we do have 12 now. Okay, any questions? Commissioner Woodard? All right, if you're for this resolution to table, vote aye. You against it, vote no. No, anybody no? Ayes has got it. Thank you, Commissioner Woodard.
Sir.
Hey, is any old business bring from the commission?
Mr. Chairman, just to clarify something here, that motion that we table, it will come up at our next meeting. Is that correct?
If bring it off the table. Yeah.
The point of order of that is that if it doesn't come in the next meeting, it will be considered gone and board.
Right.
Okay.
And some people think, I think if a commissioner that tables, one's got to bring it off the table. I don't necessarily, that's not necessarily so. It's been tabled, everybody voted table it. So if you voted table it, you got the right to bring it off the table. Okay. All right. Any old business bring from the commission? Seeing none, any new business? Okay, Chair recognizes Commissioner Bobby Hogan for election of notaries.
Mr. Mayor, I have analyzed the application of those wishing to become a notary. With that, I recommend that we elect all of those that have applied to be a notary for the county of Robertson and the great state of Tennessee.
Second by Commissioner Moore, Stacy Moore. I don't have to say anymore, Commissioner Moore. The first say aye.
Aye.
Want to oppose? Mr. Hogan. I would like to say, just for information, that we have another person down in zoning office. Could be extended sickness. 4 vacancies. The jobs have been posted, and Trey Fan will start doing interviews this week, we hope. Got to fill these real quick. and they're very important. We gotta get business back to usual. With that, I'm looking for one more motion. Bubba Glover.
Motion adjourned for this evening, sir.
Bubba Glover shrimp. All in favor, say aye. Anyone opposed? We are adjourned.